As a young citizen of India, armed with technology, knowledge, and love for my nation, with a vision of transforming India into a developed nation, I'm joining Surbhi University. What about you?
Greetings from Surbhi Institute of Engineering and Technology, Meerut, deemed to be University, and its Centers of Excellence, Center for Informatics Development, Solutions and Applications, and Center for Industry 4.0 Technology Studies and Applications, in association with the African Asian Rural Development Organization, ARDO, New Delhi, organized this weekly international webinar series on open source digital technologies towards self-reliant India, Atmanirbhar Bharat. Today is 22nd May 2021. On behalf of the Honorable Chancellor, His Excellency, the Secretary General, ARDO, Honorable Vice Chancellor, the faculty members of the university, and on my behalf, and as Professor Emeritus and Chairman of the Centers of Excellence, Center for Agricultural Informatics and E-Governance Research Studies, Center for Agribusiness and Disaster Management Studies, Center for Informatics Development Solutions and Applications, and Center for Industry 4.0 Technology Studies and Application. Let us welcome our guest speakers of today's webinar. Mr. Rahu Mithal, Founder, Editor, and Chief Ideation Officer, ReThink India, and Madam Dr. Surbhi Vaish Mittal, President, Aarogyam Institute of Integrated Medical Sciences, and Practioner of Integrating Allopathy with AYUSH. Under this international webinar series, these two centers of excellence, CIDSA and CITSA, have organized so far 28 lectures, namely, open technologies to provision simple and economical IT infrastructure, a roadmap for students using free and open source software and reaching goals of Atmanirbhar Bharat, open source software and industrial IoTs for SMEs, free and open source software adoption and business models, open data platform for smart digital government, technology imperatives, make in India for self-reliance, edge artificial intelligence, data governance for data-reliant India, Digital India transforming governance and society, India's email service, citizen@indiamail.com in 22 constitutionally recognized languages, need of the hour, ecosystem architecture for digital transformation, education system cyber critical infrastructure, seizing opportunities in open innovation and value creation network in the digital world for self-reliant economy, ensuring food safety and compliance through technology, Digital India, urgent need for semiconductor manufacturing in India, technology investment in agriculture value chain, role of foreign direct investments, entrepreneurship and skill development, artificial intelligence design pathways, the rise of platform economy, revisiting value chain governance, the era of automation, industrial robotics, and Industry 4.0, Indo-German perspective of technology transfer, skill gap analysis, and opportunities, role of artificial intelligence in healthcare, current developments in diagnosis and vaccine research, digital agri-tech and agri-startup perspective, health informatics network value chain, e-health systems and beyond, leveraging emerging technologies for ensuring transparent and traceable agri and food supply chain, unleash the power of citizen development for enterprise software development, e-governance models towards sustained quality service to citizens backed up by technology. Indian MSMEs to adopt Industry 4.0 technology capabilities, urgent need for mentorship and accelerator program, building public digital platform using microservices and APIs, health informatics network value chain, early childhood development and learning. Health informatics network value chain, a healthcare startup perspective by Mr. Kavin Kumar Kandaswamy, an young entrepreneur and dynamic innovator, scheduled on 27th March 2021 and then on 8th May 2021 was not held due to some medical emergency. We adjourned our weekly webinar series on Thursdays and Saturdays till 30 April 2021 due to unavoidable circumstances. We expect Mr. Kavin Kumar Kandaswamy will deliver his address, maybe in the month of June on the very important topic, health informatics network value chain, a healthcare startup perspective. Today is the 29th edition of this very important webinar series. We'll have the talk by our guest speakers, Mr. Rahu Mithal and Dr. Mrs. Surbhi Vaish Mittal on the topic, health informatics network value chain, clinical AI, clinical artificial intelligence, interface between machine language and health informatics. Keywords are, please note, health informatics, machine learning, artificial intelligence, and clinical AI, and health informatics network value chain. Health informatics value chain is going to be a $1 trillion economy in the days to come. To recall, on 23rd January 2021, Mr. Vivek Verma, advisor Aarogyam Incorporated, an artificial intelligence startup, New Jersey, USA, is from Chhattisgarh, talked on role of artificial intelligence in healthcare, current developments in diagnosis and vaccine research. It was well received. On 6th February 2021, this webinar had the talk by an NRI entrepreneur, Mr. Nilesh Kannade, whose organization builds a customizable e-health systems technologies based on WHO 2010 resolution on the topic health informatics network value chain, e-health systems and beyond. On 20th March 2021, Dr. Nadadur Janardhan, IAS retired, talked on health informatics network value chain, early childhood development and learning. The proposed health informatics network value chain is expected to integrate the mother and child tracking systems up to the village level, which is an e-governance initiative of the Ministry of Health and Family Welfare through open APIs. The government of Orissa is taking a very leading step in operationalizing the mother and child tracking system, through an enterprising software industry on e-health systems technologies. I am associated with that. Before this talk, on 5th September 2020, Dr. Jebamale Vinanji Arachi, former principal advisor to the Director General, United Nations Industrial Development Organization, UNIDO, Vienna, Austria, addressed the webinar series on the topic, very important title, Seizing Opportunities in Open Innovation. Seizing Opportunities in Open Innovation and Value Creation Network in the Digital World for Self-Reliant Economy. Health informatics network value chain has subcomponents such as human health system, that is public health systems, plant health systems, animal health systems, fish health systems, soil health systems, water quality systems, and air quality systems. Now, this has to be seen, the health is rather than concentrating on disease management, it's better to focus on health, having these components. If we have this network value chain operationalized up to the village level and house level, then there is no need to have a lockdown in any of the foreseeable pandemic situation in the country. We can identify the people who can have a problem, and we can quarantine them. Digital technologies in healthcare has the components of database technology, big data technology, decision support tools, IoT, WOT, sensor technology, GIS technology, artificial intelligence, language computing technology, remote sensing technology, 3D printing technology, blockchain technology, social media technology, cloud computing technology, TV white space technology, and mobile technology. We normally now come across various keywords like e-health, digital health, health informatics network and value chain, and clinical AI, that is clinical artificial intelligence. India has got the roadmap through Atmanirbhar Bharat. This is the vision of our Honorable Prime Minister, Shri Narendra Modi, of making India a self-reliant nation, rested on 5 I's: intent, inclusion, investment, infrastructure, and innovation, based on 5 pillars, namely economy, infrastructure, systems that represent 21st century technology driven, vibrant demography, and demand, whereby the strength of our demand and supply chain should be utilized to full capacity. This was announced on 15th May 2020. Vocal for local to make it global is a demand-based economy system which is self-producing and self-consuming. Make in India, make for India, and make for global. Digital world, the rise of platform economy. Application of big data, new algorithms, AI, blockchain technology, open API, and cloud computing is changing the nature of work and the structure of economy. Platform economy is economic and social activity facilitated by digital platform. Digital platform economy is emerging, and digital ecosystem are essential for digital transformation in the digital world. We need to have a digital health platform. Digital health is a multidisciplinary domain involving many stakeholders, including clinicians, researchers, and scientists with a wide range of expertise in healthcare, engineering, social sciences, public health, health economics, and data management. 3 most popular domains of digital health technologies include telemedicine, wearable technologies, and augmented and virtual reality. Computational simulations, modeling, machine learning approaches can model health-related outcomes. Digital health platforms continue to emerge and evolve. One Health, Eco Health. FHIR is a standard for healthcare data exchange published by HL7. Digital health means artificial intelligence and machine learning based on platforms that aggregate patient data. National Digital Health Mission of India, One Nation, One Health, aims to streamline digital health ecosystems in India. The One Nation, One Health card will digitize the health records of all Indians, making patient data accessible and inclusive in one card. National Open Digital Ecosystems in Health. Platformization and National Open Digital Ecosystems node can unlock economic opportunities worth of $700 billion for India. According to a study by management consultancy, BCG, and Impact Investor Omidyar Network India in September 2020. This is a national open digital ecosystems in health platformization and national open digital ecosystems, can unlock economic opportunities worth of $700 billion for India. This is very important to be noted by the, interested health tech startups in the country. National Digital Health Blueprint 2019 recommends that a federated architecture be adopted instead of a centralized architecture for the management of digital health data to ensure interoperability, technological flexibility, and independence across national digital health ecosystems. Health informatics value chain, human health, plant health, water health, fish health, animal health, soil health, and air health. Indian healthcare system includes allopathic system of medicine and Indian system of medicine, including Ayurveda, Siddha, Unani, and homeopathy. Today, we are very happy to have this one of the speakers who practices the the integration of allopathy system of medicine with Indian system of medicine, Ayurveda, Siddha, and Unani and homeopathy. One Health Eco Health aims at strengthening the links between human health, animal health, management of environment, that is plant, animal, fishery, soil, water. The Doubling Farmers' Income by 2022 report recognized Integrated Farm Health Management, Volume 12B, Chapter 10. Health Informatics as established uses information technology to organize and analyze health records to improve healthcare outcome. Is health informatics rapidly evolving field and getting influenced by and impacting on many different knowledge domains, namely nursing informatics, dental informatics, public health informatics, medical informatics, biomedical informatics, consumer health informatics, computational biology, telemedicine, electronic health records, data interchange through standards, etc., etc. Bioelectronics, as an application of principles of electronics to biology and medicine, is likely to be a cost-effective and reliable technology for a society 5.0. Digital health startups are bringing novel technologies such as wearable technology, telemedicine, genomics, and artificial intelligence to the Indian healthcare systems. We need a digital transformation, that is building public digital platform using microservices and APIs in the healthcare sector. Microservices means, from the strategic perspective, especially follows the Unix philosophy of do one thing and do it well. This is what is needed in health informatics. We will have a different discipline, but as far as the human health is concerned, it has to draw inspiration and decision support and consultancy and various stakeholders input is needed to analyze a human body, and this is very important. That's why adoption of microservices architecture based on from Unix philosophy of doing one thing and do it well, that's more important. Data underpins the 6 P's of digital services: personalized P, paperless P, presenceless P, proactive P, perceptive P, and pervasive P. These are all very important. This is very essential for clinical AI. Today's Indian Industry 4.0 is tomorrow's Industry 5.0. And Industry 5.0 tomorrow is healthcare industries and hospitals. See, Industry 4.0 is today. Tomorrow Industry 5.0 is tomorrow. And Industry 5.0 tomorrow will be witnessed in healthcare industries and hospitals. Now let me introduce something related to AI in healthcare so that the participants will be in a position to understand the speaker's address very effectively. AI is revolutionizing healthcare with game-changing capabilities. Healthcare systems that have strongly invested in digital health will be the first to realize AI innovation. Health systems that have strongly invested in digital health will be the first to realize AI innovation. No data means no AI. Poor data means poor AI. Artificial intelligence have various subcomponents: natural language processing, symbolic AI, computer vision, machine learning, deep learning, speech processing, and robotics. And artificial intelligence combined with big data hold the potential to solve many clinical trial challenges. Big data and AI technologies are complementary, as AI can help to synthesize and analyze ever-expanding data. Let me quote some use cases inspired by ethical, social, and political challenges of AI in health. AI solutions to monitor and assess health of a human population in order to select and target public health intervention based on AI-enabled predictive analysis. AI-enabled predictive analysis is necessary for population health. Second, AI technologies, especially neural networks and deep learning, to assist drug discovery and design. Use omics technologies for personalized therapy and deploy AI tools for clinical trial design and execution. AI-enabled clinical care pathways are novel technologies that fit AI-based solutions into existing and new clinical workflows, such for diagnostic or prognosis purposes. AI-enabled patient-facing solutions that uses AI to interact directly with patients and other users, including the delivery of non-clinic therapies, chatbots, personalized health advice, interventions without risk for harm, and information provisions. AI-enabled optimization of health operations refers to the use of AI to optimize back-end processes in health systems such as procurement, logistic, staff scheduling, emergency service dispatch management, and authorized completion and analysis of medical notes and other documents, patient experience analysis, and many more. Optimization of health operations in a transversal use case, thoroughness, health, and care can touch the back-end optimization of the previous four use cases as well as in its own right. There are 5 use cases I talked about it. Clinical AI is artificial intelligence in healthcare known as deep medicine. In an overarching term used to describe the use of machine learning algorithms and software or artificial intelligence to mimic human cognitions in the analysis, presentation, and comprehension of complex medical and healthcare data. Key challenges for the translation of AI in healthcare include those intrinsic to the science of machine learning, logistic difficulties in implementation, and consideration of the barriers to adoption as well as of the necessary socio-cultural or pathway changes. There are 4 ways clinical AI will transform healthcare 2021, as seen by the article which is written by Zenobia Brown in December 29, 2020, enabling enabling the shift to value-based care, personalized medicine, preventing suicides and overdoses, understanding social determinants of health. With this background, let us turn to the address by Dr. Mrs. Surbhi Vaish Mittal and Mr. Rahu Mithal on the topic Health Informatics Network Value Chain, Clinical AI Interface between Machine Learning and Health Informatics. Healthcare informatics and clinical AI thereby are the best servants when the entire value chain is modeled as a semi-automatic washing machine instead of a fully automatic machine, which is not just only needed but can have counter effects too, according to the synopsis of the speakers of today. This topic will motivate and galvanize the participants watching over telecast through facebook.com, Sobit University India, or youtube.com, Sobit University India, for motivating them to establish Industry 4.0 startups in healthcare to strengthen health informatics network value chain in the country, facilitating no more lockdown due to pandemic, if any, that is deep medicines startups. Let me introduce our guest speakers to the participation of this webinar. Dr. Surbhi Vaish Mittal, MBBS from All India Institute of Medical Science, and she is All India rank holder in CBSE 1998. She is the founder of Aarogyam Aayush Healthcare Foundation, New Delhi. Dr. Surbhi Mittal happens to be an empathetic healer par excellence who broke the glass ceiling by backing the top ranks in All India medical entrance exams in her times and also coming out with flying colors in her medical training at the prestigious All India Institute of Medical Science, New Delhi. Her commitment to community medicine and competence in integrative medicine makes her a dependable and first to contact medical professionals across all dimensions of human health. Dr. Surbhi goes to an extra mile to this effect and leaves no stone unturned as this contributes the core of her medical philosophy of delivering freedom from disease. Dr. Surbhi is rather spearheading a doctor on record movement by way of her Aarogyam Institute of Integrated Medical Science, which trains and orients MBBS students into the emerging domain of integrative, preventive, and protocolized family medicine, something in line with the National Health Service of United Kingdom, whereby the general practitioner remains the first line of contract of any medical ailment to ensure quality and accountable healthcare delivery. Dr. Surbhi is in fact the proponent of AYUSH, Allopathy plus Ayurveda, Yoga, Unani, Siddha, Homeopathy, and is working towards developing integrated medical protocol around the same. Let me introduce Mr. Rahu Mithal, founder, editor, and chief ideation officer, ReThink India, and co-founder, Aarogyam Aayush Healthcare Foundation, New Delhi. Mr. Manish, can you put the profile of Mr. Rahu Mithal? He is BTech and MTech from IIT Kharagpur. He is the most important inspiration behind ReThink India, the deeper sense of serving the society, nation, and humanity at large, taking him on a differentiated life trajectory. A prolific writer, spellbound speaker, and an original thinker, Raghav has been an active force across a vast cross-section of frontiers, ranging from grassroots development discourse to a global policy deliberations. The better half of Dr. Surbhi, Raghav, happens to be an ideator, strategist, and operation backbone at the Aarogyam Aayush Healthcare Foundation and its vast range of initiatives. Raghav consults and advises a vast range of organizations to accomplish their full potential and to re-engineer themselves for the future. A social entrepreneur by profession, a nationalist humanitarian by conviction, a technologist by education, and a change maker by passion, Raghav dons many hats spanning across academia, industry, and government. We are very glad to invite you to the both our guest speaker, Madam Dr. Mrs. Surbhi Vaish Mittal, and her father is known to me for more than 2 decades. And her, better half, Mr. Rahu Mithal, he also known to me for more than 2 decades. To this important international webinar series on open source digital technologies for self-reliant India Atmanirbhar Bharat. Topic: Health Informatics Network Value Chain, Clinical AI, Interface between Machine Learning and Health Informatics. Welcome to both of you. Over to both Mittals. Thank you.
Thanks a lot, sir. And it's indeed a pleasure to speak something in the august presence of someone like Professor Moni, who is the doyen of the whole technological development, especially the information technology development in the developmental sector. Sir has his over 4 decades of prolific, I would say, not just advocacy, but practitioners' work. So there is no, while Sir was introducing the whole centers of excellence at Shobhit University, right, it's a whole universe in itself. एक गागर में सागर भर दिया है और since it's more of an academic presentation, हम लोगों ने सोचा है कि one of the windows to knowledge is obviously the language. So we'll try to make it a bit of a bilingual as well, because we feel that this presentation or this session is meant primarily for the aspiring youngsters of India, and especially from the hinterland across, that what all these technological advances do bring on their table. Because technology has both aspects, its fascination, but at the same time, the fears and the frustrations around it, because lots of jobs are getting lost. This COVID pandemic has a lot of toll on people. So our focus would be more on as to how this entire technological universe can really empower them and really present them the whole 360-degree perspective. उसका पूरा एक डिसेक्शन करने का भाव है. और डॉक्टर सुरभि एंड जो आज का टॉपिक है वो हमारे जीवन में सार्थक है. AI in healthcare or healthcare in AI is like a marriage of medical discipline and technology. And in our own professional and education lives, I am a technocrat, she is a medico, we are married in real life. So this is what healthcare in AI is, something which we would like to present as a couple. We have two different perspectives. I come as an engineer, she as a medico. We have two distinctive ways of thinking and to approaching a problem, and that really comes from this distinctive backgrounds. So, Dr. Surbhi, on this.
Very good afternoon, friends, and this is such an honor and such a good platform and opportunity to talk about, clinical artificial intelligence, or, the health informatics aspect. And, as a medical student, I call myself a doctor and a medical student because, in medical profession, we are learning all the way. And so as a doctor, we are adopting newer and newer technologies. And you believe me, when you enter the operation theater, no step is possible without technology. So, and today is the era of robotic arm surgeries. So I think technology and health informatics is very important. And it has a very critical role to play in terms of data, in terms of analytics, in terms of decision support systems in clinical science. But at the same time, as I come from the medical backgrounds, I would also like to assert the importance of human brain, human intelligence. So coupled with, I think it's a beautiful...
here I would just like to tell to our viewers who would be listening this talk that AI in healthcare is quite a very unique paradigm. I tell you that AI as a discipline, when it emerged, when computational technologies evolved to an extent, it started modeling the human machine, which happens to be one of the finest and the most complicated, the most sophisticated machines, whether it was researches on OCR, optical character recognizer, or various problem-solving tools. The whole artificial neural network, which is the backbone of the entire AI universe, is drawn from our human brain. The neural network, it comes from our brain. How a small child starts learning, how a human learns. So first and the foremost, artificial intelligence was modeled around the human body, the human machine, how the creator has machine, the very discipline is helping the humans to deal with their own human bodies. So this is quite a very, very interesting development which has happened, that AI which has used the human body for studies is now developed to such an extent that it is helping the humans to unravel the human body even further.
True that, and I think where we are having mass population data today, the COVID pandemic, where we are vaccinating, the elderly, and the mass vaccination drive is going on. So it's very important for the electronic health records, the data, the large data of patients being input, and so the relevance is very much there. And I think health tech startups have an important role to play.
Yeah.
We must encourage the country, the indigenous, like the National Institute of Virology has developed the indigenous co-vaccine. So the health tech startups, I think the marriage of technology and healthcare has to happen in a major way.
So as instructed by Professor Moni, and we have just culled out some 30 odd slides to give a bird's eye view of the whole universe of healthcare in AI. AI in healthcare. And as we work on the paradigm of integration, as our institute, Aarogyam, Institute of Integrated Medical Sciences, which not only integrates the various medicinal systems like allopathy, the most modern allopathy, with the traditional ones, the AYUSH ones, we also try to integrate the various organ systems, like in medicinal field. Dr. Surbhi would tell more that the era of super specialization has also created a lot of diagnostic challenges. That's where the doctor on record movement is so very important, that you have to view a human body, a human entire ecosystem, the human health as an integrated whole. And Professor Moni takes it to a different level altogether, being a rishi of Indic knowledge traditions as well. He says that plant health, the animal health, he has expanded the whole vistas of health to a different dimension altogether. So integrative view is so very important, that if we get a 360 view of things, then we can focus upon each and every sector, and we can interpret the sectors from an integrated view. So both things are very, 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 very important, the integrated view and the incisive, the precise view over there. So with the help of these slides, because and we will try to keep it more conversational, because healthcare, AI in healthcare is a marriage of two very important disciplines, the technology, the computational sciences, as Sir has said about the healthcare informatics ecosystem. And today there is a lot of tug of war between the terminologies per se, because this is how the whole ecosystem works, whether it should be augmenting the health informatics, the continuum, or the AI is trying to subsuming, we are the new big boy on the block, and let everything be known as an AI ecosystem. So that debate is still on. Sir has synthesized it beautifully, and that is where Professor Moni's great acumen does come in play. और ये भारतवर्ष की ही नियति है कि भाई एकम सद विप्रा बहुधा वदंती, कि लड़ाई झगड़ा छोड़ो, synthesize करो, integrate करो, and end goal remains very, very clear. End goal is welfare, the outcome. Absolutely. That is so very important. And as the adage of All India Institute of Medical Sciences goes, Sharir Madhyam Khalu Dharma Sadhanam.
Absolutely. Sharir Madhyam Khalu Dharma Sadhanam. The Sharir is a vahan for the ultimate attainment of salvation or the soul's emancipation.
So what we have done is like, first and the foremost, on the terminology per se. See, natural language processing is one of the core components of it. भाषा के माध्यम से हम भाव को ग्रहण करते हैं. So artificial intelligence provokes the connotation to a layman is somewhat of what artificiality, क्योंकि हम लोग originality की बात करते हैं. हम लोग आज the biggest deficit today is not of anything else but trust. So artificiality has a different connotation. So alternatively, people are saying, why not use the term augmented intelligence? There is a natural intelligence, there is a machine intelligence, and combined together with the whole ecosystem which comes through, it becomes an augmented intelligence. So this is the integrated view which we wanted to present to our viewers. Yes, the technology is AI, it started with that, it has a legacy, but we can probably use a more positive term of, say, the augmented intelligence. It has a more trust building factor, a confidence building measure. Because as we will see in our later slides, that there is a lot of fear that around 35% of the jobs in United Kingdom alone in the next 5 to 7 years might get transformed to machines itself. So that's a very big fear, because jobs, the human livelihood might be at a risk because of AI and automation. So with that background, we will take, in a positive format, we will take this presentation forward. So quick definitions, because at times we feel that we know a lot of things, but what are the denotations? What are the definitional aspects of it? So artificial intelligence in healthcare.
Artificial intelligence in healthcare is an overarching term used to describe the use of machine learning algorithms and software or artificial intelligence to mimic human cognition in the analysis, presentation, and comprehension of complex medical and healthcare data.
So in the very definition, viewers, it has said that this whole technological universe is all about to mimic human cognition. Now, some of the questions which arise out here, quick questions, we will respond to them later, that how well the human cognition can be mimicked. In some cases, yes, AI bots, AI algorithms have proven to be much more effective, but they do have their own limitations also. And the second questions which keep on coming to us is that, is there a need of mimicking human cognition in a sensitive area as that of healthcare? So, so this is what AI in healthcare, the definitional aspect of it is all about. So just an example that this is an X-ray.
How the bone age, is being calculated from the X-ray of a hand with automatic calculation via computer software.
So it speeds up the life of a diagnostician.
Absolutely, the diagnostics, the radiology, it helps tremendously. It's very fast.
Yeah.
Very
So this is what artificial intelligence in healthcare, the definition of it. Now, what is the distinguishing facet of AI in healthcare? So the distinguishing factor from other traditional technologies, see, we have been using CT scans, PET scans, lot of pathology, lot of technology has been there to assist, as Dr. Surbhi said, that a doctor in a clinic or in a hospital just cannot operate without the power of technology. Technology has eased up their jobs like anything. But AI is the ability to gather data, process it, and give a well-defined output to the end user. Now, here I would like to emphasize upon, as Sir has mentioned, the term health informatics. So, gathering data, so informatics per se. So, these are the three core pillars of the whole AI ecosystem. Where
informatics is the science of processing data for storage and retrieval, which we call the information science.
So this is how the whole information technology germinated, that how through bits and bytes information can be stored. We had the flip-flops, the whole computational technology which used the electronics, which used a lot of electronic circuitry and everything. So, and that's how the sophisticated information systems came into being. So EHR, EMR, they're all healthcare informatics where the clinical data is collected and stored and retrieved. Now, what has happened over a period of time that AI scientists have felt that can this information be processed further in a more intelligent fashion? Can these huge data sets of patient records, of clinical trials, of drug discoveries, can it be used? So they use two very distinctive technologies. The broader one is the machine learning algorithms. Now, machine learning, for the viewers in a very, very layman sense, how a small kid, he or she starts recognizing literals. We tell them this is A, and we say a meaning that this design, this pattern is A, this is B, this is C. Similarly, this is 1, this is 2. So that's how the machines are trained. There are very definitive algorithms to do it. And the machine learning algorithms over a period of time have become so sophisticated that a whole paradigm of deep learning machine learning algorithm, this is a subset of the whole universe of machine learning algorithms, which gain useful insights and predictions.
Using extensive amounts of input data from healthcare information systems.
So we will just clear the term in the next slide further to just put up a distinction. So what is deep learning? Because across AI, this term you will witness over and over and over again, deep learning. So deep learning happens to be a class of machine learning algorithms that uses multiple layers to progressively extract higher level features from the raw input. So there is a huge database with us. So from database, a machine has to learn what all it means on its own. So deep learning algorithms, they use a layer technology. आप लोगों ने देखा होगा जब हमारे यहाँ bandwidth कम होती है तो image blur करती है, चाहे वो video है, चाहे वो imagery है. But even if we have a blurred image, we make sense of something. Acha, this is suppose me sitting over, a human is sitting over here, a male is sitting over here. And when more data comes on top of it, the clarity starts coming in. In fact, human life में भी जब हम कोई नया subject पढ़ते हैं, तो at first वो subject हमें समझ नहीं आता. बहुत धुंधली क्लास में, if Professor Moni is taking a class on deep learning algorithms, in his first lecture we all will get bowled up over कि सर कुछ समझ में नहीं आया. But yes, in the first lecture, the first layer, the first iteration, we have made some sense what is being said, some keywords we will pick up. So this is similarly these deep learning algorithms, they pick up learning, and this is all modeled. Mind you, it's very easy to understand AI and its dynamics if we just focus back to our own human learning, because the entire AI modeling, yes, it is done in machines, yes, this is done in servers, yes, very fancy algorithms or the programming languages are used to code that logic, but eventually it is all modeled around the human brain, how the artificial neural networks, they process information and they distribute communication nodes in biological systems. So it's very easy to emulate. If we can have this analogy, it will be very easy to understand this whole dynamics of deep learning. And this in itself is a deeper course, and Professor Moni is running some very specialized centers to really train the young students, the new generation computational scientists. And he has plans to have specific programs for healthcare in itself. So
I would like to draw our attention to this very important point. Specifically, neural networks tend to be static.
Yes, yeah.
Static and symbolic, while the biological brain of most living organisms is dynamic and analog. So this was just a parallel direction where we need to keep this in mind. So what
Dr. Surbhi is trying to impress upon is that despite the fears across that, what AI might do, AI has its own limitations. See, the biological neural network, the biological neurons are still much more advanced, and it will probably take many more decades perhaps for the computational scientists or for the mixed teams to really come up to this level of creating dynamic and analog neural networks, more sophisticated ones. So this is a distinction that the limitation part of it. We have put this slide specifically to show AI vis-a-vis HI, the human intelligence, and together with it becomes a augmented intelligence perhaps. So there are certain structural limitations of artificial intelligence. There are two structural limitations.
Yeah.
One is the specificity. Any algorithm you make it, algorithms are literal. Once a goal is set, the algorithm learns exclusively from the input data and can only understand what it has been programmed to do. It doesn't happen to the human brain.
Yeah.
In a classroom or in any of the conference, if you say something, the human brain starts expanding the frontiers of whatever has been talked about it.
Correct.
And that's where the dynamic aspect of a human neuron.
Absolutely.
But this specificity has got immense application. We have to understand this distinction. Because once we understand this distinction, we have a control over things. All the miscommunications, misnomers, they go for a 6. So whatever is talked about in the sci-fi movies, that's probably a much different era or epoch per se. The second limitation of AI is lack of logicity, which we have coined the term. Some deep learning algorithms are black boxes. Algorithms can predict with extreme precision, but offer little to no comprehensible explanation to the logic behind its decisions, aside from the data and type of algorithm used.
It's like programming.
So essentially, artificial intelligence is all about pattern recognition. The deep learning algorithms, they go to the data sets, the data is modeled very sophisticatedly, and it recognizes a lot of patterns. And based on those recognitions, it develops a capability in itself to predict in particular use cases. So specificity and lack of logicity, these are two things which can be put to an immense utilization. But yes, this is where the emphasis has to come, that is why AI has to be married to HI to become the real AI, the augmented intelligence.
Absolutely.
Beautiful. So if we can synthesize them, and this has to happen from the very beginning, because what happens, many are technological use cases, they came with a lot of ennobling factors, but because of the larger finance involved, the larger corporate interest involved, they got very narrowed down to the researchers had a very ennobling mindset. It is all offered on the plate in a very, very nice fashion. But when it actually comes in real implementation, then the sovereign regulations go for a 6, and the corporate takeover of the big finance.
So the end goal of welfare has to be kept in mind.
Yes.
Why we are innovating, why we are adopting technology to such a level, the combination, the augmentation, the amalgam of artificial intelligence with human intelligence needs to be there.
Because that will allay a lot of fears from the practitioners, because since the topic of today's talk is all about clinical AI. Because if AI has to succeed, the clinicians at large who are really practicing in 6,000 townships of the country, they're also serving the 6 lakh villages. We are talking in the Indian context largely. They have to get empowered. This is our servant. This is not going to be a master. Because technology has really reached to a stage where the tech imperialism, the terms of tech colonialism are being talked about, and AI is something which people are really wary about. So that's why we wanted to present this very strict distinction before moving forward.
Indeed.
Now, what are the end goals? So largely in the whole academic domain, in the practitioners domain, and also the policy makers domain, there are largely 3 end goals of AI. The first goal is obviously from the researchers and developers. One of the centers of excellence, what Shobhit University is hosting under the stewardship of Dr. Moni.
The primary aim of health-related AI applications is to analyze relationships between prevention or treatment techniques and patient outcomes. AI programs are applied to practices such as diagnosis processes, treatment protocol development, drug development, personalized medicine, and patient monitoring and care.
So these are the dimensions which really need the unfoldment of technology in a big way.
True.
For example, the protocolized healthcare, which Dr. Surbhi, you are practicing yourself, that a lot of misdiagnosis is something which is there in our country, because the patient load is so very high, and the collection of the data in a very structured fashion, the ecosystem is not just there. So probably the entire AI ecosystem, the healthcare AI ecosystem, can force fit that the practicing clinician can get to a higher extent
The excellence parameter, I think, can be more greatly achieved, where we talk of AI programs to treatment protocols. Say, for example, history taking is an art. The systematic per disease, the number of questions, type of questions, which need to be digged meticulously into the practitioner's mind. AI helps a lot in that.
See, even today we go to even a super specialty hospital, the kind of data which is taken from us in order to heal us is not in a very elaborate framework.
Not that coherent, yes. Yeah. According to the need and requirement of the clinician.
So this happens to be one of the end goals, and this is something which the entire medicinal fraternity is looking forward for more empowerment per se.
In fact, the United States, to name a few, the Johns Hopkins, the Mayo Clinic, the Sloan Kettering and Cancer Research Care Center, all these the high-end clinics are working on AI-based programming protocols.
And just for the sake of our viewers, like treatment protocols, what Dr. Surbhi is talking, that India still has to come up with her own native medicinal protocols. And at Aarogyam Institute of Medical Sciences, we are developing a tool called Dhanvantari, which is an AI-based tool itself, which is synthesizing the allopathic protocols of various disease or symptomology with the AYUSH protocols. And we are trying to present, like there is a lot of debate today between the preventive medicine which is being offered by the AYUSH fraternity and the formal big pharma associated with the allopathy fraternity. There is a kind of a war between Israel and Palestine. That kind of a statement is there. So, but what is the need is that these are parallel systems of medicines which have got developed in various parts of the world. So why should only one system have a monopoly over things? So we are trying to bridge the gap by putting up all the disease symptoms and what treatment protocols are offered by allopathy, and parallelly what are offered by Ayurveda, by yoga, and can we somehow juxtapose all of them? It's still in an academic curiosity phase, but this is what we are trying to accomplish using the standard AI programmable tools over there. The second end goal, which obviously has a lot of applications in the industry, it regards the patient data analysis. Dr. Surbhi.
AI algorithms are also to be used to analyze large amounts of data through electronic health records for disease prevention, diagnosis, and insurance processing. Medical institutions such as the Mayo Clinic, Memorial Sloan Kettering Cancer Center, British National Health Service have developed AI algorithms for their departments. Large technology companies such as IBM and Google have also developed AI algorithms.
So we'll be coming to these algorithms, what all platforms, what all applications these big companies are doing. Very important factor is the insurance industry. See, in the West, in the US, the entire healthcare industry is governed by the insurance companies, and they have to come with their own predictive premiums, the differential premiums over there.
Absolutely.
So they are the ones who are investing their big dollars. And now these are the commercial considerations. As I said, that any ecosystem can be devised, but from whose perspective it is being devised is very, very important to make. One is from a researcher's, a technocrat's point of view. The other is from an industry player's perspective. The third is obviously the regulator's perspective. Like Ayushman Bharat, one of the largest healthcare insurance scheme, which was rolled out. So AI is being used, epidemiological studies, like what kind of diseases are there, and all sorts of patient data analysis. This is being used. This is another big cluster of applications. And obviously for the aspirants of AI in healthcare, all the courses which maybe Shubhit University is planning to start off, this one segment is going to be the most paying ones for the graduates, because obviously the commercial considerations are extremely on the face of it.
Also from community health point of view, the disease prevention aspect of electronic health records, we have a field called epidemiology.
Mr. Mittal, at this point, I would like to emphasize, you brought it very clearly. There's a reason only the Soviet Institute of Engineering and Technology would like to bring out, by seeing the importance of the data and the health informatics, we need to generate human resources in the area of health informatics.
Yes,
so we would like to motivate students with the biology background at the plus 2 level, especially the girl child.
Yeah.
those having biology background to get into BSc Health Informatics,
Yes.
and then from the BSc Health Informatics get into MSc Health Informatics, so that there will be a strong human resource professionals available for data analysis. Today it's not
Yes.
available.
Absolutely,
And
sir.
so then it will be a very good addition to and a helping aid to the for developing a constructive and meaningful clinical AI. Because without health informatics, with a health informatics professional, we can't have a meaningful clinical AI. So thank you very much for bringing in a business model which is necessary for the students to get into health informatics. Thank you very much. Proceed.
And so one of the points which we also like to add upon over here is that in the word of future, maybe a certificate program, a 1 semester long program in AI in healthcare can also be offered to all medical students per se. Because until or unless you have a familiarity with the informatics part of it, because see, doctors are some of the finest, I'm saying they are some of the finest analytical machines, and they are at times faster, because in the computational graph, the artificial neural network graph, their training allows them to jump many of the Turing machine steps and jump to a conclusion. So if probably in the first year or second year of the medical course, we are in fact talking with the new body of MCI, that if a certificate program, a 1 semester long program for all medical students, the 44,000 MBBS students, it can be offered. So it will have three effects. First, their familiarity will remove the fear early on, because we as humans, we have got our own subjective biases. So once we know for sure that what is this AI all about, we will get attuned with that. We had Professor Anil Sahasrabuddhe the other day in one of our other programs, and AICT had earlier removed the requirement of mathematics primarily for going to engineering. See, what has happened in our country is we have very bigger cliches. Education is very personalized. So biological students going for computational AI, for biological AI, this is a unique. It's like interdisciplinarity will come in over there.
True.
For studying computer science and at this level of abstraction, you don't need to have a calculus background. You just need to have logic background. Tark Shakti hamare paas honi chahiye, and everyone can go over there. So I think salute to Shobit University, and under your stellar leadership, you have really envisioned 30 years from now, the way you had done it in NIC, that you had envisioned the district program right in 1980s. And yesterday when we were commemorating the late Prime Minister Rajiv Gandhi, we were talking about the 6 technological missions which were established in that epoch, and one of them you were leading. So this vision into reality and an academic institution, and thanks to Shobit University for really coming out, for developing it from their own resources, spread across. And with this kind of, I would say, convergence, with this kind of integration between an academia and from industry and government, I think it's going to have a phenomenal turnaround.
Absolutely. And I was trying to draw attention to a point where we talk of epidemiological studies, like we have, say, MS biotechnology or bioinformatics, health informatics courses when we start them. So, in like much of data is not of use to us unless it is analyzed, it is sorted, it is categorized, and then we have the statistical analysis done to it. So this is where disease prevention has a very important role. So it's not necessary that all biology students become doctors per se. You are doctors of the health science.
The whole paramedic universe.
The whole paramedic universe. We have courses in hospital administration, diplomas and master degrees, where non-MBBS students like pharmacy students or BSc students can join hospital administration programs, and their AI is very important, where we have the supply chain, we have the patient data, we have discharge summaries, this is where technology is majorly playing a role, and computer softwares and intelligence in the artificial intelligence or the augmented intelligence category. I think this is where decision making, when to admit, we have so many beds in a hospital, how to do the analysis, triaging. Again, this is very important. So at the helm of the affairs, where we have the leading decision makers, the administrators. So this is also another point where very much doctors are the best. They're very well suited in the.
In fact, Dr. Surbhi, as you mentioned, the front office desk.
Yes.
That is also one of the very critical component of hospital admission.
Absolutely, because
now if they get a very elaborate forms, AI-enabled form of registration.
Oh, that would make things very, very simple.
Otherwise, for the doctors, the data is not there. They have to go for the history taking. A lot of stuff goes over there.
And very often we go to the front desk of hospitals, the top corporate hospitals, and we see the front desk is, just nonplussed at a medical terminology, because they don't have a AI assisted, program or format which can quickly say, okay, feed the keyword. Say it's a cardiac angina. Or is it a cardiac symptom? It is a neurological symptom. Now they don't know angina pectoris. So if we have AI-assisted programs, it can really assist.
The entire burden passes on to the treating doctor, not to the supporting ecosystem.
Yeah, and the earlier the treatment comes, the golden hour, the platinum hour we talk in medical science. If 15 minutes are spent at the front desk trying to ascertain what angina is, so then you cannot administer the treatment at such a critical level. So AI has a major role here as well.
So the third end goal, and which is all about the commercial productivity, because healthcare has become an industry, and in our country, the regulators, the Honorable Supreme Court has put education to be in the social domain, but healthcare still has been given the for-profit corporate hospitals. And in fact, the entire country is facing the whole challenge of overcharging and all that stuff. So hospital ecosystems are looking for AI software to support operational initiatives that increase cost saving, improve patient satisfaction, and satisfy their staffing and workforce needs. So the productivity aspects do come into place through the utilization of AI. And
companies are developing technologies that help healthcare managers improve business operations through increasing utilization, decreasing patient boarding. Here we are talking of patient stay and discharge time, reducing length of stay, and optimizing staffing.
Now, these are all the considerations again for the insurance companies. They want to optimize that if you get admitted to a particular hospital, you should not overstay because their premium payment. So they are using these elaborate data models to come out with their own decision matrix over there. So these are the three larger end goals of AI which are being used, and wherever the utilization is there, the job market for the students trained in the various dimensions of AI would be there. So a lot of applications have started coming up. Moving forward, the current research, we will move now in a reverse fashion, that what are the areas of research in which AI is proving to be in some areas much more effective than the human experts, and in some areas at par, and in some areas things are progressing. You will all be astonished to know that the United States of America has made a 400% hike in their AI-assisted healthcare ecosystem. Last year, 2019, it was just a $463 million US, which was spent. And now this year, last 2020 stats, $2 billion US have been invested. And in India, the top government think tank, Niti Aayog, it has come up with an elaborate paper, a research paper on how AI is going to supercharge India's startup, India's innovation ecosystem. They are also now priming the government of India to really create artificial intelligence missions in conjunction with the Atal innovation missions, and to really, I would say, supercharge, to really catalyze, to really take them to a different level, health informatics to a different dimension, because this is a great advantage for India. We are still at a very infancy stage of our public healthcare informatics. So we have not invested in our copper lines that much. So we came all of a sudden on mobile technology. So it is a great time that whatever health informatics, public health informatics we now invest upon, that will be AI enabled. There is no advantage ki bhai, today we install a past generation of healthcare informatics. So any healthcare informatics for which a public investment has to be done now in India after this COVID pandemic subsides, it has to be AI enabled, and probably our regulators. And so there is a huge, I would say, opportunity for youngsters who are looking for white collar jobs, scholars in the technological domain. Look, this is the next revolution which is coming across, because health, after 2% of the GDP spending, Government of India is going to really work on our public healthcare system so that we are defended against any of these futuristic COVID. I give you a very small case study right over here. If we really had our refined healthcare informatics in place, this entire vaccinization mayhem would have been averted, because we would be having the database of all the 133 crore people with us, that who are the vulnerable segments, who are the lesser vulnerable segments. Absolutely. So that could have been done at the click of a button. So no head scratching for our Secretary Health. He would have got the reports straight away down at the block level. And that is where I would say professionals like Dr. Moni, they have to lead such a mission, because he comes from a balance. And that's where we at ReThink India have a strong advocacy of publicly owned institutions, because that strength makes you balance between the commercial considerations and the public welfare. Otherwise, at that level, it is very difficult to, like the vaccine manufacturers have done. ICMR has put in so much of effort, but somehow or the other, its brand name is not at all coming in the Bharat Biotech advertisements over there. So that's another matter. But this is where our researchers have to really become activists as well. You see, look, this is on the public money, public rupees. Yeah. We have developed this capacity, we have developed this market ecosystem. Now this has to revert back on public investment if a research has happened. So a significant portion of it, at least in the public welfare, the benefit has to come to the public per se. It cannot become a matter of becoming a billionaire. Like in the newspapers, the reports were coming, the vaccine manufacturers have become the new billionaires of human agony. Really so ethics have to be the underlying bottom line of any research, like when the nuclear project was there. Yeah. So these are some of the areas in which AI is having a lot of research dimensions. We just wanted to give a quick snapshot. Like in dermatology, Dr. Surbhi.
So dermatology, we have, the contextual images, the macro images, the micro images. So analysis of bulk data, they can be algorithms to,
So dermatology is a natural fit for AI, because image processing helps in a big way for a dermatologist ki what kind of an ailment is out there. A lot of dermatologist AI assistants might be there who might be taking up your imagery of your disease area with a special photograph or whatever. And that's one of the applications. Similarly, radiology has the highest level of AI implications. The CT scan and MRI, they are all images, and computer algorithms can really, like today in the COVID chest
HRCT score, we all are talking 17 on 25 is the ominous score. So why? I mean, this is all algorithm based.
A Stanford study has shown that pneumonia is detected better by an AI bot rather than radiologists per se. So a lot of detection algorithms, oncology for that matter, it's having a lot of applications over there. A lot of companies are coming up with their own products to use AI in radiology in a very, very big way. The cost has reduced significantly because of all this. AI has a lot of role in screening of
as I mentioned,
chronic
diseases. Statistics,
Yes.
Like, say for example, oncology, where we talk of cancers, like we are saying that this is a particular belt of cancer in our country, the various states. So the AI bots, especially mammograms.
So this statistics is very interesting. It's a factual statistics that human dermatologists could identify diseases up to 86.86%, but the CNN machine, is a deep learning algorithmic machine, and it could identify the disease to 95% of the cases. Because see, human sensors have a limitation with age and with a lot of disruptions coming in. So why not give that particular area which can be given to machines, Delegate. And the human intelligence can augment on top of it. So these are some of the examples which we just wanted to say In breast cancer detection, AI is coming in a big way. Very specific use cases of AI are being implemented.
Maxillofacial surgery or
prostate cancer, they have come to 98% sensitivity and 97% specificity.
So sensitivity and specificity.
Yeah, we can go on and on, but we just want. Even in psychiatry, AI is coming in a big way, because psychiatry requires a long hours of sessions with the patients to come to a particular conclusion. It's still in a proof of concept phase, but psychiatrists are also using some of the chatbots to ascertain as to where a particular patient is lying over there.
Absolutely.
AI is also being used in primary care in a big way, and that's where its application in India, at the PHCs, at the CHCs, all over, because anyone can become an AI assisted doctor. You need not go through a 5-year long curriculum. Any paramedic can go over there, have a small system with a 3G connection on a mobile set, and he can start recording the ailments of the people. So it will filter down from I would say normal diseases to the more chronic diseases. That's where
so in primary care especially, 85 to 90% of the ailments are can be assisted tackled at the primary care setting.
So I think this is one dimension, sir, where Shobhit University can really talk to the healthcare departments of especially all the state governments, that all the new bhartis which you are doing at the lower level of the assistants, everyone should have an essential understanding or training into the primary care AI, whatever applications are there, because familiarization is very important. Once someone gets into a government service, वो उसके बाद training and grooming becomes a very difficult part.
So in primary care, an AI assisted paramedic or a doctor or a medical professional, he can be in continuum, in connect with a physician who is a specialist or a GP.
And any which ways, all the pharmacists of the country, they are some quack doctors themselves. वो over the counter drugs for many of the ailments. भारत का जो स्वास्थ्य division है. So maybe
this needs to be checked. The quack.
No, that's fine. But what I'm trying to say is that every pharmacist, they have an understanding of pharmacy.
Yeah, that's true.
But they can also be oriented into the primary care
absolutely.
spaces out there.
And telemedicine today in the COVID pandemic, especially primary care and telemedicine, both are, hand in hand,
So AI has a huge application in disease diagnosis. Now, this is a very elaborate slide where the AI bots are given some training goals and they are being evolved. So this is the kind of advances which we wanted to show to our viewers, that a lot of techniques, like for example, to demonstrate some specifics for the disease diagnosis and classification, 2 different techniques are used in classification of these diseases, including ANN, which is artificial neural networks, and Bayesian networks. So artificial neural networks have been found to be better, and they are accurately classifying the symptomology with diabetes and CVD in the human body. Many of the disease symptoms are very closely placed.
Yeah, absolutely.
So
multi-organ involvement is there.
Yes.
So diabetes is not just a pancreas involvement. When it goes, the disease progresses. So this is where multiple case scenarios. Each human body is a particular separate case study.
But I would just like to emphasize again, we can go on and on. All this wonder would happen only when there is a baseline layer of health informatics.
Absolutely.
Because until or unless we have a data set, electronic healthcare records, the Prime Minister had announced last year, but until or unless we have actionable health records,
true.
The undecipherable readings of the medical,
very
so it's very difficult to process it in a database and come to intelligent works. So AI has a lot of applications in the telemedicine part also. The wearable technology, sir was mentioning a lot about it.
Yeah.
Like SpO2 measures. Now they can have sensors if SpO2 goes down. So that kind of innovations are coming, that you might have given some treatment to a patient, but he's monitoring remotely if some vital goes down. So you can set up a rudimentary ICU back at home also.
Oh, yes.
That's where
home monitoring, home care is a very important aspect. And here, with AI-assisted tools and diagnostics, say blood sugars. Blood sugars, we are very usually, we don't measure so frequently.
So electronic healthcare records are utilizing AI like anything there. But then, mind you, the Western countries, they have come up to the 80% level of documentation. Every doctor is mandatory to work on an EHR. But in India, a simple A4 sheet with your stamp of a DMC certification just makes. So this wonder needs the baseline foundation, and that's where the topic of today's seminar, sir, has not just talked onto the fanciful frontier of AI alone. He has said the health informatics value chain. Now, for the viewers, that is why this topic is so very pertinent, that until or unless we have a baseline health informatics, the value chain cannot be augmented to the level of AI and all the wonders which this technology has in place.
And very rightly, as we mentioned in the slide, physicians do not have the bandwidth to process all this data manually, and AI can leverage this data to assist physicians in treatment.
Yes. So lot of AI is also used in drug-to-drug interactions. Today we have got multi ailments. हमारे को diabetes भी है, हमको BP भी है, हमको कोई sciatica भी है, and now very many pills we are popping, but we don't know what is the interaction between the multiple drugs over there. So AI is being used in drug-to-drug interactions. A lot of challenges have been created. A lot of databases are being done, like doctors, when they are diagnosing and giving some prescriptions, they run through these databases that okay, is this, if you have a kidney ailment, is this medicine safe? Today it is being done through memory. But once an AI driven ecosystem comes into place, the compliance, I would say the
overall outcome.
Yes, the error on part of the physician because of the overload will reduce like anything.
Correct. That's true, very much.
In the creation of new drugs, because drug development is a long as the word was, the COVID vaccines have been evolved in a very record time. It takes half a decade to a full decade for a vaccine to come. But using the artificial intelligence data sets, the simulative power of it all, these are some of the wonders. The whole life cycle has got reduced phenomenally.
So like DSP 1181 for the
Let's
OCD, Wilson's for...
So many more. Now, this is very important, AI in healthcare industry, because research and development makes path for the industry, and that's how it gets further into the market. So the big healthcare companies are merging together. India, thankfully, we don't have a public healthcare database. In the West, the private companies are owning up all the data sets. So this is again the Niti Aayog paper on DEFA. Probably Professor Moni would be having another Center for Excellence on the open data policy. That who will own the data? Who will own the public data? Which is a big debate. So in the West, the companies are merging just for the very purpose that they will have larger sets to analyze and process from. And the bigger the data, the bigger the different sets of patients you have, and better the results you can have. So they are also creating clinical decision support systems, big data in healthcare, because bigger the data, as I said, the more effective the AI algorithms would be. So these are some of the big projects which are running. I would encourage the viewers to go to the webpage of each one of them, because they have a different use case, different vision. They will give a real practitioner's understanding that what all AI is capable of and would be capable of. So IBM's Watson, the famous Dr. Watson of Sherlock Holmes. So IBM has taken that moniker from there. So Sherlock Holmes is a lovely detective character. So Microsoft's Hanover, Google's DeepMind, Tencent's and even the SpaceX CEO Elon Musk, he has premiered the surgical robot. So in addition to going to Mars, he feels that still life is there on Earth. So let's invest some of the top dollars on AI in healthcare. So this is what some of the big healthcare initiatives. Apart from these big healthcare initiatives, a lot of startup initiatives are happening. One of it is the Haptic. It's an Indian startup which has recently developed a WhatsApp chatbot which answers questions associated with the deadly coronavirus in India. So for the Indian startup fraternity, for the IT chaps, healthcare is a dimension where there is a huge scope of deploying technology over there, especially AI, because we are a very vast nation, the geocultural locales and the patient backgrounds, because Because human bodies, they react to a different geocultural locale, the food habits,
the environment,
yes,
the ahar, the food, the lifestyle, all these are factors which determine the health.
So probably there is a whole lot of a need for a specific healthcare innovation program where healthcare apps across various dimensions are also developed. So a lot of startups are coming in which are using multiple dimensions of AI to solve the diagnostics issues. Big companies are setting up research divisions of AI, and very important is that even the car manufacturers are coming forward to deploy AI bots in their cars. Now this is a very, like, they got music into their air cooling into there. So automobile industry, apart from getting e-mobility, the electrical mobility, they're also trying to stop what is the drivers, they're testing their drivers' influence of substances or emotional distress to make their safety parameter over there. So these are some of the higher dimensions of applications which healthcare AI is coming towards. Now, very important, labbe labav, mudde ki baat kya hai bhai, कि ये जो AI आने वाला है, what it is going, in what ways it is going to transform. The first and the foremost is it is going to decrease medical costs drastically. And it is going to increase the accuracy of diagnosis and good predictions. Dr. Surbhi would tell you more that how many cases of misdiagnosis, because she takes only tertiary level patients, that because of lack of time or lack of commitment or lack of proper history taking, how much of misdiagnosis happens?
So misdiagnosis is very common. We take the approach of differential diagnosis, and after differential diagnosis, we arrive at a provisional diagnosis, and there the fundamental final diagnosis comes. Now, diagnostics is in a science in itself, and there is where AI can play a very important role, where multiple factors, we have the red flag signs, so rule out. If you have a program, quick, protocol, you can just embed into that. And then prediction, where we talk about prognosis, based on these statistics, based on these factors, based on these, statistics in the facts in the human vitals, how you can predict that how soon,
I think more than that, see, one distinction I would like to make, the general quality of our doctors, like in our engineering education, technological education, there is a quality improvement program which is done at the IITs or whatever. So the top doctors, they obviously are trained and oriented and they are committed to that process.
True.
But I think this AI process would augment the average quality of a diagnostician, average quality of a doctor phenomenally, because he or she would be force fitted to follow that process.
Very much. And the concept of ethics and standardization, like the NHS services, the nationalized health services, they follow the NICE guidelines, the NICE protocols. And that is why, the chance of misdiagnosis reduces once you have an elaborate, systematic history taking, the vitals, examinations, it's outlaid. Though the human intelligence factor, I would again say, is important. But then AI can account for so much of misdiagnosis it can prevent.
Yes. Moving forward, at the end of the day, healthcare is a very, very complicated discipline because it is bound by legal, ethical, regulatory, economical, and social constraints. So healthcare is not like simulating for a next generation algorithm for a gaming part, because it concerns the human body. So, for example, even before the third trial, our Covaxin got into a controversy because our DG medicine gave a provisional approval for it. So there will be a requirement of parallel changes. So AI adoption is going to depend upon if we will work on all these frontiers simultaneously. We have to work on the legal foundations of it all. A new legal doctrine has to come into place so that our courts give the I would say protection to the whole space, the ethical dimensions in the society, the regulatory aspects. So these things have to go in parallel for AI to really make the intended change over there. Also, AI is being used to care to developing nations, unserved nations. Like when COVID has reached to all the rural frontiers, it's very difficult to diagnose and all. So I think we will not correlate over there, but AI would really help the uncatered areas.
And also in the interior parts of the country, the rural districts, where the care, the physician to patient ratio in our country is already, we are at a big time low. But then with the help of AI, we can reach village to village, district to district, and with the AI bot who is taking the vitals in the first level of care, primary care can be delivered.
Now, this is the last and very important aspect, that with great power comes greater responsibility. So it's very, very important that we also create a larger regulatory structure beforehand, before we adopt the entire power, we unleash the power of technology. Like पहले हमारे यहाँ रामायण काल में ब्रह्मास्त्र जो था वो राम जी को ही दिया जाता कि भाई उनमें वो मर्यादा है, वो उनके अंदर वो रेगुलेटरी पावर है, the misuse will not happen. Ashwathama abused the Brahmastra, but then Krishna had to intervene and stop the carnage. So AI is presenting a lot of, this is again a subject of a very separate talk, but a regulatory structure is required because new type of risks have come, like algorithmic bias, do not resuscitate implications, and other machine morality issues. This is again a huge area, but a person who is taking a technical course in AI should be sensitized enough for these regulatory and ethical issues also. Because if you are using something like when I get a driver's license, I have to be attuned and sensitized to the basic driving rules and regulations. That sensitization, how it goes forward. There are a lot of ethical considerations around AI. There are largely 3 of them which are documented in the literature. The bias. Now, bias is there in the human mind. But technology, वो कहते हैं ना कि a person is not corrupt. Power doesn't make a person corrupt. Power just brings about what is inside a human being. So AI is unleashing tremendous amount of power to the human mind. Absolutely. Now, with that tremendous power, the biases, the natural biases in each one of us, they start coming in. अरे भैया हमारे पास अगर SpO2 का जखीरा है तो उसकी black marketing कर दो. These kind of proclivities do come into play. तेरे को जुगाड़ है तो मैं तुझे बेड दिलवा दूंगा. So this bias has to be formally regulated and contained over there. Automation का जो threat है, we have been starting saying it from the very beginning, that there are statistics कि 35% of the jobs in the UK alone are getting risk because of AI. So obviously, and sir said in our initial introduction to the talk कि भाई AI को एक semi-automatic washing machine की तरह use करो, कि unleash the strategic part of it, but don't make it a fully automatic washing machine. I should have some options where there is a human component associated. Beautiful. So the cost also goes down, and the human interface, because in the context of India, we have 133 crore mouths to feed and fend for. So the deployment designs of AI has to be seen in that fashion. And obviously, data collection is another ethical consideration, because
privacy issue also.
Yeah, today news is there that Air India, the mighty Air India, has leaked all its data sets, all the credit card numbers, all the privileged things have got in the open. So people are really wary about it. So these are some of the ethical considerations. And we would love your feedback. So we have finished all the 30 slides in 60 minutes time. And so so you have to unmute. Yeah.
Thank you very much, both Dr. Surbhi, Vaish Mittal, and Mr. Rahu Mithal, for your very insightful, forceful, and intelligent address covering all aspects of the health informatics network value chain. And I am very much pleased, and both, even though you are professionally interconnected and also family-wise interconnected, but it is a good combination of is not only allopathic versus Indian system of medicine, but it is both medicine, medical science and technological science, both working together. I'm very happy about that. But you have brought the important issue of that, the clinical AI is the importance of clinical EMI in every aspect. And he also recommended a 4 months course to be initiated by the Soviet University, and also the health informatics courses like BS and MSc. Now, before I give my observations and suggestions, and also for the discussion, I would like to request Dr. Mayadath Joshi from the Soviet Institute of Engineering and Technology of Meerut campus, that his understanding of this lecture. Over to Dr. Joshi.
Yes, good afternoon. Good afternoon, everyone. I'm audible. Namaskar. Thank you, Professor Moni, and for inviting me to present my views on the very important topic. And I'm very thankful to the speakers, both Dr. Mittals, for delivering such a nice and very informative lecture on such an important topic of machine learning and health informatics. So today I'm very grateful to Professor Moni and for organizing such a very informative lecture on the health informatics network value chain, and that is clinical AI interface between machine learning and health informatics. So very great information is delivered in the lecture by both Dr. Mittals, and it is very helpful, especially to all the students who are doing studies in BTech or higher level studies. Or it is also the lecture is very informative for all the faculty members of the university, and for I think it is so informative that how we can use the artificial intelligence in the area of health informatics, and how this AI can be used for disease diagnosis and treatment of different type of diseases, like you mentioned cancer, because I have a huge experience, postdoctoral experience of working on cancer from Harvard Medical School, Boston. So, but basically, I focused on the cell biology, and many people I see that they in US and other countries also they are using this machine learning. They have already started this machine learning and this artificial intelligence in the area of healthcare. So, but here, as the Professor Moni is saying that we want to start this system, this skill-based system, and that how we can interrelate the technology with the health informatics. So, I think that the information delivered by both the doctors and their experience they shared, it is very wonderful. And it is I again want to thank you both of you for delivering such a nice very informative lecture. And also you mentioned that how the AI can make our work much easier. But here we have to keep in mind that how we can interrelate this technology and health. So this is the and students, our technology students and faculty members, they can also utilize this knowledge as delivered by you in the session. So we are we gained good knowledge from your lecture. And now how we can solve the ethical issues related to healthcare with AI and with machine learning. It is a very new technology, and I think that if we have a much more idea that how we can utilize this knowledge for the students and for the benefit of students, so that we can start a new course in Soviet University Meerut. So it is really beneficial for the students and for the faculty members and everyone who are working in the healthcare sector. So very nice and very good lecture. very informative lecture delivered by both Dr. Mittals. And I think that all of us and who are listening to this lecture, we are benefited with your views, and we will certainly, with the support of Professor Moni, we will certainly plan to start this course in which we can relate the AI or machine learning with the health informatics. We can start in our university. Thank you very much, Professor Moni, and thank you very much, Dr. Mittals, for such a very nice and informative session. I think all will be benefited with this information that you delivered during the lecture. Thank you very much, sir. Thank you.
Dr. Mayada Joshi has done his postdoctoral work in Harvard University. He has a vast, rich experience, and he's also working in bioinformatics area, biotechnology very effectively. And that's why I requested him to, give his feedback. This is the first time I'm using my fellow colleagues, from the university, that please listen, you listen and give your feedback. So thank you very much, Dr. Mayada Joshi. That's the reason only that, in addition to that, I also would like to inform you that university has got a highly technological biomedical engineering lab, and also this biotechnology lab, and also bioinformatics discipline. And that is the reason only that we with the strong on informatics, and we would like to establish a school of health informatics and computing in the university, and to promote the health informatics discipline very effectively in collaboration with the industry, academia, industry, collaborations. And that's the reason only I also mentioned during the course of the lecture that BSc Health Informatics and MSc Health Informatics, is very important. And then this will cover not only public health informatics, means in creating AI in healthcare, related disciplines for the medical, students, but we have to look into that, health informatics, public health informatics, and plant health informatics, animal health informatics, soil health informatics, water health informatics, fish health informatics, and soil and air, because these are all affecting human components, very health components. I would like to quote the work of Dr. Alexis Carrel. In 1912, he has written in his book that how important the soil health is. The soil health determines the metabolism of the cells of human, plant, and animal. The soil is not healthy, human cannot be healthy, plant cannot be healthy, animal cannot be healthy, which includes fish which is growing in water and soil, water bodies. So that's why from 2010 onwards, I have been, as a non-medical professional, as an informatics scientist, I have been propagating this integrated, from the point of view of agriculture, integrated farm health informatics, which includes farmer health. Now with the COVID situation, this is expanded to the complete health informatics. And from the university side, we also published a policy paper. And also in the Doubling Farmers Income Committee report, Doubling Farmers Income by 2022, report 2018, I was instrumental for two subcommittees, volume 11 and volume 12B. The volume 12B talks about digital technology in agriculture. We have suggested 7 mission mode projects, in which one is on digitalized integrated farm health management system. It means that you look into this health aspect as integrated in 2018. And that time, COVID is not there. The report has been submitted to Government of India by Dr. Ashok Dalwai's committee, in 2018, and and also notes that this 85% of the disease which we get come from animal. I think doctor is sitting there in front of us, Dr. Surbhi. She can approve us, or if I'm wrong, I can be corrected. And it is very important that health has to be focused, not the disease. And that's very important. And I'm very happy that even though I requested them to deliver a talk for 1 hour, now it started at 11:30. It is now is 1 o'clock, 1:15. It means that it is more than 1.5 hours talk. We had it, and I will request both Dr. Surbhi Mittal and Mr. Rahu Mithal, even though I know them for the last 20 years, but I would like to request them to get associated with the university, to bring all the experts working in this discipline, because you work in e-school and you work in e-college, and also you brought it when I was about to retire, I requested you to work on e-governance campus program, which you done it on these civil services day in June 23rd, I believe, and in 2013, the next month of my retirement, I retired on 31st March, May, and you did it on June, and it's an honor for me, and I was the chairman of that session, and I'm very happy that as a man who is a creator of ideas, and let us have in your collaboration that in BSc Health Informatics program and MSc Health Informatics program. And AI, based on your lecture today, let us please work out. In collab, I will also request Dr. Mayada Joshi also to be associated, and to work out again 5 months or 6 months program on AI. This clinical AI.
Yes,
interface between machine learning and health informatics, and it will be a big contribution to the country. Nobody is talking about it. Nobody's talking about it. And let us do this one. And thank you very much for taking your busy schedule and participating in this program. And all your slides are very important. You've done a very good research work to bring out these talking points today. And also, above all, Dr. Mayada Joshi has taken his time away from his university schedule time to watch this program and also give his commitment as to how this has to be undertaken in the university. Thank you very much. Let us contribute to the Atmanirbhar Bharat in India. Atmanirbhar Bharat in rural India. That is more important as far as I'm concerned. And we have to reach to every house in the village. That's what the university, and also as a principal advisor to an e-health systems technology limited, which is an NRI company based in both New York and Pune. We are spearheading that e-health systems from Latin America to Asia Pacific, and even in India, with the e-video clinic to promote telemedicine at a house level. So it is very important. Let us work together. Thank you very much. And we will close the webinar today. Thanks for your participation. Greetings from Suvit University. For more research inquiries, please contact Professor Moni Madaswamy, Professor Emeritus and Chairman, CIDSA and CITSA, and former Director General, National Informatics Center, Government of India, New Delhi. Email ID is moni@sovituniversity.ac.in. We thank His Excellency, the Secretary General of African Asian Rural Development Organization, and the Honorable Chancellor of the Soviet Institute of Engineering and Technology, Nimtip University, for giving this opportunity to host this program to the participants of India and abroad. We close the webinar Lead Studio. Thank you.